Stroke. We often imagine it as something sudden, a silent bolt out of nowhere. But the truth is, most strokes don't come without warning. Before the brain is permanently damaged, the body sends subtle signals, quiet, fleeting moments that we often dismiss. Maybe your hand went numb for a minute. Maybe your speech slurred for a few seconds. You felt dizzy after standing, or your vision blurred briefly and returned to normal. These are not random symptoms. They are transient ischemic attacks, or TIAs, your brain's way of knocking before the door slams shut. TIAs can happen days or even weeks before a full-blown stroke. And if you catch them early, especially within 24 hours, you can prevent serious damage, even save your own life. The tragedy is, most people don't know what these signs mean. They think, "I'm just tired," or "maybe I skipped breakfast." And then the real stroke happens, and it's too late to undo what's been lost. Your body is speaking, and your job is to pause and listen. We've all heard that high blood pressure causes strokes. But what if I told you many stroke victims had normal blood pressure before the event? That's because there are other, quieter culprits at work, slowly, steadily damaging the brain's lifeline without us even noticing. One of them is chronic dehydration. When you don't drink enough water, your blood thickens. Thicker blood flows slower, it clots more easily, and in a narrow artery in the brain, that clot is all it takes. Another is high blood sugar over time. You don't have to be diabetic. A diet full of processed carbs and sugar spikes your glucose, damaging the delicate lining of blood vessels and triggering inflammation. Over time, those vessels narrow, stiffen, until one day something blocks them completely. Then there's chronic vascular inflammation, the hidden fire in your arteries. It's fueled by stress, smoking, poor diet, lack of sleep. It doesn't hurt, but it quietly eats away at the walls of your arteries, making them fragile and unstable. These causes don't come with alarms. They build up in silence, and when they act, it's often fast and devastating. Stroke prevention isn't just about managing blood pressure. It's about creating a body environment where blood flows freely, smoothly, and safely every hour, every day. When people hear "prevent stroke," they often think of extreme diets, hard workouts, or expensive supplements. But the most powerful form of prevention is far simpler: living in rhythm. Your body thrives on consistency. A consistent sleep cycle. Regular meals, not skipped and not overloaded. Daily light movement, not punishment, just motion. And space for stillness, for breath. Sleep is where it all begins. When you sleep deeply, your brain clears out waste, including beta amyloid, the protein linked to memory loss and vessel damage. Lack of sleep hardens arteries, raises blood pressure, and makes you more vulnerable, physically and emotionally. Then comes balanced eating, not perfection. You don't need to eliminate joy from food. Just lean toward whole, unprocessed meals. Less salt, less sugar, more color on your plate. Food can be medicine, but it can also be poison if we eat in chaos. And finally, move gently every day. A 20 to 30-minute walk can boost circulation, reduce inflammation, and sharpen your mind. Studies show that even walking daily can cut stroke risk by up to 58%, even in people over 80. You don't have to change everything. You just have to do a few small things every day without giving up. When someone survives a stroke, people usually focus on the body, the limp hand, the slurred speech, the wheelchair. But there's another layer of pain, one that's invisible. After stroke, The brain is chemically imbalanced. The person may feel anxious, hopeless, irritated for no reason. They might not recognize themselves. They may feel ashamed for needing help, or scared they'll never recover. But this isn't weakness. This is the brain trying to find its balance again, rebuilding its own inner circuitry after trauma. And that takes time. It takes safety. It takes care. Family becomes medicine, a kind word, a familiar voice, a warm meal. These are signals to the brain, you're still here, you're still loved, keep going. When people feel emotionally safe, the brain starts to wake up. Memory, language, movement, they all respond more powerfully when the person feels seen, valued, and connected. Recovery starts not in the muscles, but in the heart. Here's something beautiful. The brain can relearn what it has lost. It doesn't matter if you're 40, 70, or 90. If you give the brain the right signals, it will build new pathways, even after damage. This is called neuroplasticity, the brain's natural ability to adapt. Think of it like a forest trail. If one path is blocked, your brain can carve a new way through the trees. But it needs three things: repetition, emotion, and meaning. The more often an action is repeated, the more solid the connection. When that action is tied to positive emotion, a smile, a laugh, a sense of pride, it becomes easier and faster to learn. And when the task has meaning, like holding a spoon, folding laundry, hugging a grandchild, the brain understands this matters. Recovery doesn't end after 6 months. It can begin any time, at any pace, as long as there is purpose. Music is not just sound, it's memory, it's rhythm. And for the post-stroke brain, it's medicine. Listening to music for just 30 to 60 minutes a day can activate areas involved in memory, language, and mood, especially if the music is familiar, something the person loved in their youth or heard during joyful moments. Music doesn't need words, but it helps the brain remember words. It stimulates the emotional centers and from there awakens cognitive function. Sunlight works the same way. Morning light signals to the body, wake up. It balances hormones, improves sleep, boosts energy, and lifts the fog of depression that often follows stroke. And then there's the most powerful therapy of all, human connection. A shared meal, a gentle conversation, sitting quietly together without pressure. These are not extras, they are essentials. A woman who folds towels every evening with her daughter. A grandfather who listens to his grandson read a story. A man who begins humming again after months of silence. These are not miracles, they are reconnections, small signs that the brain is finding its way back. Stroke is not the end of a life. It's the beginning of a new kind of life, one that requires patience, courage, and care. But it is still yours. Recovery may be slow. It may feel uneven. Some days will be quiet victories. Some days will test every ounce of hope you have. But every day you try, your brain tries too. Don't count the days, count the moments that return. A smile, a step, a simple word. Each one is proof that healing is happening. You are not broken, you are rebuilding, and when your heart begins to light up again, your brain will follow. If this message touched you or reminded you that recovery is possible, please consider subscribing to Everyday Wellness Pathway. We share real, human stories of healing and simple ways to care for your brain, body, and spirit every single week. Your support helps us keep going, and together we can remind the world stroke is not the end. It's a new beginning. Thank you for listening. Take good care of yourself and those you love.